and a couple more people might trickle in as we go. Thank you for coming to our Tri-State Dairy Exchange, Navigating the Future of Dairy webinar. Today we're going to be talking about transition cow health with Dr. Kathryn Bach. Dr. Bach is an assistant professor of practice at Cornell University College, the College of Veterinary Medicine. And next month we will be talking about on-farm assessments and audit programs, so stay tuned for that. That is a different date. That's going to be on November 19th, so not our traditional last Wednesday of the month, just because that's the day before Thanksgiving. So just as a reminder, our mission at the Tri-State Dairy Team is to advance dairy management, address shared industry challenges, and foster innovation through collaborative education programs across northern New England. And we work together in Maine, New Hampshire, and Vermont. And our team includes Dr. Glenda Pereira from the University of Maine, myself from New Hampshire, and Whitney and Amber at the University of Vermont. And the main Farmcast is releasing new episodes every Wednesday. And this coming October 27th, you can also go to the 2025 Maine Forage Conference. In New Hampshire, coming up this Sunday, we have a very casual dairy producer end of season gathering that you can register for. On the 11th, there's an on-farm soil compaction workshop. And then on November 12th, we have our annual corn and forage meeting where we will be talking about kind of a recap of this year's forage crops and what we saw with the weather events. And we will be talking more about soil health and compaction as well.
Yeah, and in Vermont, in case you haven't heard, the American Dairy Expo is coming to Essex next week on November 5th and 6th. So two-day event, Wednesday and Thursday, and it's shaping up to be a really great event. They have over 200 vendors and exhibitors from around the world, and if equipment is your jam, all the new paint will be there, I think. There's several halls featuring all the big players in the industry, and there will also be a dairy classroom where presentations will be facilitated both days. Whitney will be talking about milk quality on Wednesday afternoon, so we hope you can join us there. And we'll have a booth there. We'll be there both days, Whitney and I. So if you are local or up for a road trip, I think it will be worth the drive. Admission tickets are available online or at the door. Shannon just dropped the link in the chat. Thanks, Shannon. Also happening now, we're right in the middle of the Fall Northeast Cover Crop Council webinar series. There's a session today on cover crops and nutrient dynamics, and next week's session we'll cover cover crops and water dynamics. You can still register. We'll put the registration link in the chat as well, and you can catch up if you've missed any. You can catch up on our YouTube channel for all the recordings. And lastly, next week, it's a super busy week. On Friday, our friends at the UVM Extension Champlain Valley Crop, Soil, and Pasture team will be facilitating an afternoon pasture walk at Meach Cove Farm in Shelburne, I believe. So we'll be focusing on stockpiling forage for extending the grazing season, and their primary grazing species there is sheep, but I have been assured that all of the information shared and discussion will be applicable to all production livestock. So we can put the registration link for that event in the chat as well.
All right. Thanks, Amber. And if you are into podcasts, we have another podcast recommendation. You can check out the Hordes Dairyman podcast. Their goal is to provide trusted science-based information that you can use on your dairy farm. There are a lot of producer spotlights, which I think are pretty cool. They provide practical resources for current challenges that we're seeing, and a lot of information on animal health insights as well. And with that, I will turn it over to you, Dr. Bob.
Hello, everyone. I'm just gonna get myself over to PowerPoint. Let's get this party started. So first of all, I'm really appreciate being asked to come talk to everyone today. I always love talking about dairy cows and the stuff that I love about dairy cows, which happens to be transition time in the dairy cow's life. I'm really excited to come chat with all of you, and I look forward to sharing a little bit of information specifically on two transition cow disorders that I happen to really love, hyperketonemia and hypocalcemia. Since I'm very proud to also be a New Englander, though I'm not originally from Northern New England. I came from Southern New England. I grew up in Northeastern Connecticut, and I was the sixth generation to grow up on my family's farm. We've always raised Dutch belt cows, and by the time my dad came around and inherited the farm, he chose to become a veterinarian and was actually a small animal veterinarian. So I grew up in a veterinary practice life. But I always loved cows and ended up doing an animal science degree in college, taught high school sciences, including some stuff on ag science, and eventually went to veterinary school to become a production veterinarian. And so I was in practice out in Colorado. I practiced in large dairies and also worked with a lot of other producers, sheep and alpaca farmers, before I decided to come and do a PhD at Cornell, and haven't left since. So I've been here since 2014, basically living the life of learning everything I can about transition cows. And then now I teach in the veterinary curriculum. During my role there, I have managed the teaching dairy. I teach all of the clinical skills for the veterinary students when it comes to cows. So every single student learns everything they need to know about cows from me, basically. And I also work with an end of veterinary program called Summer Dairy Institute, which is trying to improve the dairy production focus for students that are ending their veterinary school career and would like to go in working with the dairy industry. And so I love the fact that I get to work with students from day one all the way to the moment they graduate. I am actively involved in some professional organizations that are dairy veterinary focused as well, which is one of the reasons why I have some great colleagues and friends at University of New Hampshire, which is lovely. And so I'm really excited today to talk, like I said, to talk to you about hyperketonemia and hypocalcemia, which are two disease processes I really love. So the goal for today, because I am trying to cram a bunch in, is to let you guys leave with the ability to really describe the risk factors and mechanisms involved in hyperketonemia and hypocalcemia, really understand some of the appropriateness of the various treatment strategies. There have been some changes in both these disease and conditions over time. And so some things are starting to evolve a bit. And so we're looking at some of our treatment options a little bit differently now. And then the other thing is I want you all to be able to go away with some evidence-based recommendations for prevention and management of these transition cows as well. So I don't think anyone who works with cows, I don't think this is new for everyone, but the time that cows go from being a pregnant non-lactating cow to being a lactating non-pregnant cow, it can be a bit of a challenging time for their well-being, their health, their production, because a lot has to change. We're going from a state where we're a pregnant animal, where we have like a 90-pound calf taking up the majority of our abdomen. We're not having to pull nutrients to make milk. And then we automatically one day go from that period to, I'm going to start making a ton of milk, and I have to now grow my rumen again to start eating enough feed to compensate for the fact that my abdomen now no longer has this uterus with this pregnancy within it. During this period, there are tons of changes in the requirements that this cow needs. The big ones as we move from the close-up dry period to that fresh and lactation period is a massive increase in a need for energy and minerals to support milk production. And that's all annoyingly happening at the same time that our cows are not eating as much feed. As I mentioned, their abdomen mostly had a calf in it, so their rumen's smaller. And also, if anybody's had a kid on this call right now, you may know that whole period, you've got different feelings going on. You might not want to get up and eat as much. And so we have lots of requirement and potentially not as much intake to support that. And so that's where a lot of these challenges come up. And so, as I mentioned, we're going to focus kind of on these two areas of hyperketonemia and hypocalcemia, so the energy requirements and the mineral requirements. And so first, we'll talk a little bit about energy requirements. When cows make milk, they have these wonderful mechanisms in place to help them support this. And what they need to do is draw lots and lots of energy. When we're drawing energy, to kind of put this in perspective, I'm going to talk a little bit about what these requirements are, even 2 days before a cow has calf, 2 days after they have a calf, and then what it looks like even a week into production. And so we have certain requirements for energy every day. We all do. When we're sitting even at a desk all day, our body needs a certain amount of energy just to do all of those regular day-to-day things. And so that's considered our maintenance requirement. So a dairy cow's maintenance requirement is in this green bar here. When we have a calf when this cow has a calf, they need a little bit more energy to support that growing pregnancy. But 2 days before calving, the energy requirement is about 15 megacals, which is just a unit of measurement of energy. 2 days after calving, when they start making milk, so they've started making colostrum, but they've really made a large amount. They're starting to really make milk at this point. We're basically doubling the amount of energy that these cows need. So their baseline maintenance requirements stay very similar, but now we've added this extra milk production. And if we're talking about going to making about 100 pounds of milk, which a lot of our cows are doing 1 week into lactation, whoop, wrong way. We've massively increased the amounts. And to be honest, it's up to 5 times as much energy is required to support production for this animal. And to give that, kind of put that in perspective a little bit, that would be like me running a marathon every day. That's how much energy a cow needs to make 100 pounds of milk. So it's not a small amount of energy. It's a lot. But cows amazingly are able to do that. And that's through a few different things. One, of course, is ensuring that the health of the rumen is there. If there's not a healthy rumen, none of this can happen, because we know that the rumen is what actually helps feed the cow, right? It's not actually the feed, it's the byproducts that those rumen microbes make. Of course, feed is super important. Access to adequate quality feed, which means that they have to have access to it at all times. Are we pushing feed up enough so that cows have access to it? Are we balancing our ration to the production that our cows have? Are we ensuring that the quality is there? Those are all extremely important. The other thing that's extremely important are these lovely things known as homeoretic mechanisms. And homeoretic mechanisms are basically mechanisms that are built into the body to help maintain a new state. And so the homeoretic mechanism that we see in cases of energy metabolism is this wonderful process where the body says, whoa, I don't have enough blood glucose and a couple other signals, so I'm going to start mobilizing fat. This happens in all mammalian species. It's basically what happens when you are losing weight. Your body says, oh, I don't have enough energy. I'm going to mobilize fat, because that fat tissue can be utilized as an alternative fuel source. And so you may have heard of NEFAs, or non-esterified fatty acids. These are just basically these fatty acids that come from the breakdown of this adipose tissue. And tissues like muscle can use that as an energy source instead of having to use glucose. NEFAs can also go to the liver, where the liver can make another type of extra fuel source known as ketones. And you may have also heard about those as ketone bodies, BHB. You've probably heard some of these terms kind of being passed around, something that we test for in our transition cows. These, as I said, can also be used as alternative fuel sources. And this is super important because our cows need the glucose that they already have in their body to do things that these alternative fuel sources can't be used for. So one of those are things like supplying energy to your brain. That can only be done with glucose. And another big thing is that lactose, the main sugar within milk, which also dictates how much milk volume that cow is able to make, that is only comes from glucose. So if we don't have enough glucose, we're not going to be able to make lactose and make milk itself. So these alternative fuel sources are super important for maintaining that in the dairy cow. So what's important to understand is that this homeoretic mechanism, this production of non-esterified fatty acids, or NEFA, and production of ketone bodies is completely normal in all of our transition cows. So this is a graph here. That's from a study where it was looked at hundreds of cows, and they just took blood from those cows starting before calving, going into 3 weeks after calving, and just looked at BHBs, which are one of those ketone bodies, those alternative fuel sources. And what we'll see in normal cows, we have a baseline level of this ketone body, and then when we hit calving, it starts to increase. And those ketone bodies are there just to supplement the cow as they're getting themselves into getting more feed in and adapting to lactation. So it's completely normal. The problem happens is when something in this system breaks down. Do we mobilize too much fat? Does the liver have a hard time turning those NEFA fuel sources into ketone body fuel sources? Are our peripheral tissues not utilizing the ketones alternative fuel sources correctly? And when that happens, it's a bad situation because, as you can imagine, we have a buildup of something that the body doesn't normally have to deal with. And that's when that system breaks down. When we talk about it in like medical terms, it's called hyperketonemia. So basically an elevated concentration of ketone bodies in the blood. And so if you've heard about hyperketonemia before, you may have heard that there's a specific cut point for that. And so basically, just like when you go to the doctor's office and have your blood taken and they look at and seeing if things are within normal ranges, we have a normal range for ketone bodies. And in this case, if the ketone bodies go above a BHB, which is a specific ketone body, if that goes above this cut point of 1.2 millimoles per liter, it says this animal has hyperketonemia. Now, if we have lots of ketone bodies, this disorder of having elevated ketone bodies can turn into a disease process known as ketosis. And that's this disorder that includes abnormal clinical signs. So you could walk up to this cow and know that something's wrong with her because she shows that outwardly. And so we also have a cut point for that, which we often use this 3.0 cut point for that. Cows with ketosis, so full-blown clinical disease, are going to be cows that don't want to eat. They're going to have weight loss. We're going to notice that they can sometimes be very irritable. Sometimes you'll hear it as nervous ketosis. They may even bite things, lick things, and participate in pica, which is kind of crazy. They'll eat things that they're not supposed to. And it'll also affect their blood pH. But this is not a condition that we see very frequently. And if you're a dairy producer on this call, you may say, oh, I see one once in a while, but it's not something we see on a regular basis. More frequently, we see these cows with elevated levels of ketone bodies, but not showing clinical signs. And that's considered a subclinical disease. And these diseases are really complicated because they look like a normal cow walking around. You're not going to notice them when you walk through the pen necessarily, but they're at increased risk of negative health and production outcomes. And these are things like they're more likely to be the cow that gets a DA or get metritis. They're likely going to be that cow that just isn't doing right and will end up on your culling list. She may have reduced reproductive efficiency, and she's probably not producing as much either. And we actually see this in 80% of the cases. And so we see a lot of cows walking around this. If we're talking about farms in the United States, about 40% of our cows to 60% of our cows could be subclinically hyperketonemic. So not what you want because they're likely to have negative things happen. So who are these cows that have this problem? These are often our cows that have too much body condition coming into the transition period. So, you know, those girls who get a lot of condition during the dry period, they have a lot more adipose tissue when they actually transition to being a lactating cow. So that whole mobilization of fat can kind of break down in that situation if they have too much. Cows that are older or make a lot of milk have a greater draw for energy. And so they're at an increased risk, especially if something is going on, like they have a dystocia during calving, because they need to get up and eat food. They need to support milk production. And if something keeps them from being able to support the intake they need to support that milk production, they're going to increase their risk of having hyperketonemia. There are fortunately ways to find this kind of subclinical or hidden disease. Traditionally, we've used urine and milk ketone sticks. And so those are those sticks that you put in pee or milk and you looked for a color change. More recently, we've talked a lot about, and most of the stuff we've probably read in the last 10 years about hyperketonemia had a lot to do with these blood handheld meters. How can we use these to test for cows? They all have their pros and cons, not saying that any of them are right or wrong. I personally like to use the handheld meters because the ease and the access to them. I've done a lot of work comparing different ones. So if you have any specific questions on those, I'm happy to answer that. Basic pros and cons. The urine and milk tests are measuring a color change reaction. They're very inexpensive, which is lovely. But because it's a color change reaction that we're looking at, of course, different interpretations from different people. But also, they're not fantastic at picking up all of our animals. And so what often happens is we talk about having a poor test sensitivity. So basically it can miss some of those cows that would actually be positive because the color change didn't occur correctly. So we may have cows that we don't pick up with those tests. The blood test, because it's measuring a concentration, is great because it's very, very accurate. But depending on, it seems like every year it changes a little bit. Sometimes the strips are very expensive. Sometimes they're not. You can get them on Amazon sometimes you can't. And so there are some pros and cons to the fact that they cost a lot of money, depending on where we're at in the flux of all the things. When we have cows with hyperketonemia, there are many treatment options which work, which are great. Our biggest treatment option, which the ones that I suggest to all of my clients, are oral and IV glucose precursors. I also believe the addition of vitamin B12 is very helpful. Vitamin B12 supports the liver, and so it helps the cow, once they have those glucose precursors, actually do the work they need to do to support their metabolic system. It's important to note that we do have some updated recommendations on when to use the IV dextrose. And honestly, I think you're all going to like these because if you've ever had to bottle a lot of cows, it's not fun and nobody wants to do it. So not too long ago, we actually, the research group I'm part of, did a large field trial looking at the use of IV dextrose in those cows that are hyperketonemic, but not clinical. So the ones that were walking around with elevated ketone bodies, but weren't showing clinical signs. And what we wanted to look at was treatment with propylene glycol, a standard treatment of 300 mils for 3 days each, with addition of IV dextrose, either on just the first day or for every 3 days. And what was really awesome is we actually saw absolutely no improvements when it came to resolution of hyperketonemia, negative downstream consequences, or milk production by adding dextrose. So a great new recommendation here that you guys can walk away with is that if you have a cow that is hyperketonemic, it's really great to treat her with propylene glycol, but you don't need to add that dextrose unless she's showing clinical signs. So that's always one less thing you have to do on the farm. And I love not having to bottle a cow if I don't have to. Though giving propylene glycol, I know, is its own kettle of fish. It is a preventable disease process. And some of these prevention things you're going to notice sound similar as we go through hyperketonemia and eventually hypocalcemia. But one of the big ones is focusing on nutrition, ensuring that you have an appropriate diet in the dry period. We're controlling our energy in the far off dry period. We're trying to compensate for the reductions in dry matter intake in that close-up period. And then we want to do everything we can to make that transition from the dry period to the lactating period as smooth as possible. So we want to think about things like, what's the stocking density of the fresh pen that we're moving them into? If we have the ability to separate our first lactation animals from our greater lactation animals, is that a possibility? The other things we want to think about is, if we're having a really hot summer, we really want to think about, can we do some heat abatement even in our dry cows, which I know can sometimes be a challenge because they're in barns that maybe they're not the most up-to-date barn, or they're a little bit farther away, or maybe they have mostly pasture access. What can we do to just make that less stressful for them? And another thing we can do is monitor the success of our transition period. So I put a little asterisk next to herd monitoring because the herd monitoring I'm talking about is not actually going out to try to necessarily identify cows to treat. Not saying that that's inappropriate, but the idea being that we're using it as a litmus test to see, is our management going well? And so I can't believe it's over 10 years ago now. There was this system for how do we watch how do we monitor this in our herds was published. And this is basically going in and looking at 20 of your cows that are in this window of 3 to 9 days in milk and testing their BHB concentrations. If we have a low number of animals that are positive, so this is what we talk about in this group here. This is our monitor group. So if we have only like 3 out of 20 of our cows or less, we have a great transition period system going on our farm. Things are going very smoothly. We're going to want to spot check this. Original recommendations were every other week. Work with your herd veterinarian. You may not have to even do it that frequently, but this is a way to say, okay, is my system working? If we're noticing that greater than 15% of our cows, up to 40% of our cows are showing positive for BHBs in that 3 to 9 day milk window, then we notice that we know we have a little bit of a struggle in our transition cow management system. And so we're going to want to monitor that a little bit more. And of course, treat those cows that have elevated BHBs in all of these, by the way. Just make sure that they're getting their treatment as well. But you want to see, okay, what can we look back at our system? How are we transitioning? Where are bottlenecks? Are there bottlenecks that we can address easily? Are there bottlenecks we can address tomorrow, in a year, in 2 years, those kinds of things? And then if you have a lot of cows that are in this high concentration of BHB, so like over 40% of our cows are testing positive, then we really do need to start treating. And so we need to start treating those cows and be more diligent about keeping an eye on our transition cows, because we're setting them up for a really bad transition through that period from dry to lactating. Now, another thing that's kind of changing over time, and we're realizing more and more, is that hyperketonemia in general may not actually be a bad thing, but it's when it's actually happening. And so this is going to be a little graph showing a whole bunch of research trials that have been done on this subject. And this graph here is showing on this left side the milk difference between cows with hyperketonemia and cows that were not hyperketonemic, and then the day in milk in which they're diagnosed. And so there are 2 groups that these cows fall into. Some cows make more milk and some cows make less milk. And why is that? So it seems that cows that are diagnosed mostly, and a lot of papers found this, in the first week of lactation are the ones that end up making less milk. Cows that are diagnosed with hyperketonemia or have high BHB levels later on in lactation are more likely to make more milk. And so what we're kind of seeing here is that if cows are diagnosed with hyperketonemia, so being a BHB level over 1.2 millimoles per liter, or showing positive on one of those urine or milk sticks, we're more likely to have negative health and production outcomes. If they're showing positive week 2 or higher, unless there's some other concurrent thing going on in these cows, it's actually associated with very little negative associations. And likely these are cows that just have a really strong adaptive process for utilizing those ketone bodies. And they're often these higher producers in our herds. And so I really want to kind of like drive that home, that really it's that first week in lactation. We often say 3 to 9 days in milk-ish is where we're really trying to see, make sure that those cows are the ones that are being addressed for negative health and production outcomes. Another somewhat newer thing in the story of hyperketonemia is that if there's concurrent hypoglycemia, we're actually seeing that those cows definitely benefit more from treatment. There have been 2 recent studies that have looked at this. Basically, animals with concurrent hypoglycemia, in this first paper that was done about 7 years ago now, they were more likely to resolve their hyperketonemia and have higher milk production if they were treated compared to those that were just hyperketonic alone. So treatment had more of an effect for those cows that were hypoglycemic and hyperketonic. And similarly, this other study found that propylene glycol had better increases in milk production for those with concurrent hypoglycemia. So the take home here is if you have cows that are hyperketonic and hypoglycemic, then they really need that treatment. And this may be something that we will develop further in the way we look at these hyperketonemic cows. But right now, it's just something that we're seeing a lot more research being done on. So our takeaways when it comes to the energy side of this story is that we really want to focus our diagnosis of these cows on the window or that first week of lactation. So we can even say 3 to 9 days in milk. When cows have elevated ketone bodies in that window of 3 to 9 days in milk, we're way more likely to have negative health and production outcomes from these cows than cows diagnosed later on in lactation. Another great takeaway from this, and I think a lot of people enjoy hearing this one, is not all cows need dextrose. So those cows that have elevated ketone bodies but aren't in that clinical realm, they seem to do just fine on propylene glycol alone. This is definitely something to chat about with your herd veterinarian so that, maybe you can modify your treatment protocols and not have to be bottling those cows. The other thing is cows with concurrent hypoglycemia may benefit more from treatment, and that's something that I think we'll probably be hearing more about in the future. So now we're going to move on from energy requirements to mineral requirements. Just like milk production, just like the energy requirements of milk production, milk requires a lot of minerals. The number one mineral that I think we all know because we all love dairy is that it's going to be calcium. So there are really large calcium demands for milk production. So I'm going to go over, just like I did with the energy demands, kind of what that looks like for a dairy cow. So just like energy, there is a baseline amount of calcium that an animal needs just to do maintenance everyday thing. And so for a dairy cow, it's shown here in the green bar, and that's just about 21 grams of calcium a day. At calving, so this cow has started making colostrum. We've doubled our requirements just to make colostrum alone. And then when we hit that 7-day mark where we're making about 100 pounds of milk, we've quadrupled it basically, or 3 times it. Yeah, triplet it. That's the word I'm looking for. And so we've massively increased our need for calcium. And again, it's hard to put this in perspective. So I kind of like looking at it this way. Here is what the requirements are for a human. So an adult human requires 1 gram of calcium every day. And what's really interesting, I've always meant to look this up, and so I did for today. Humans only require an increase of up to 300 milligrams of calcium when they are lactating, which is equivalent to 1 cup of milk. And in human medicine, they don't even recommend supplementing at all because the body is able, with its homeoretic mechanisms, to handle that minute increase. So again, dairy cows are like the gold medal athlete when it comes to doing this stuff. And I am going to look a little bit like a broken record again. How do they do that? It comes down to health of the rumen again, an adequate intake of quality feed, as well as these appropriate homeoretic mechanisms. So you're going to see here that relationships with your nutritionist are super helpful when it comes to managing these disease processes. The homeoretic mechanism that happens in our dairy cows to increase calcium are a little bit different. They basically revolve around a gland that's in their neck. We have them too. It's called the parathyroid gland. And when that senses reductions in blood calcium, it sends out a hormone called parathyroid hormone. That acts on the places where our body either maintains or excretes calcium. So one of those places is our kidneys. When we pee out calcium. I bet you didn't know that. And this hormone tells the kidneys, stop excreting calcium. We need to retain it. It's important. Please stop peeing it out. It's also where vitamin D gets turned into its active form. And so we'll get to that in just a second. This PTH, or parathyroid hormone, also goes to the bones and says, hey, bones, I'm going to take advantage of the fact that you're all calcium. I need some of that calcium. So it's actually going to tell the bones to start breaking it down a little bit so that it can get the calcium that it needs. I mentioned that the kidneys also convert vitamin D into its active form, and that's job is to go to the intestines, which is another place where we excrete or absorb calcium. And it's going to tell the intestines we need to absorb more calcium from our diet. So basically, this hormone is doing the job of saying, let's retain as much calcium as we can. Let's get it into our bloodstream, and anything that's in our stores of our bones, that we can use that too. And so it's telling the body to do that job, and that normally increases our blood calcium. So this is what happens if you are a lactating human being, a lactating dog, sheep, goat. This is happening to all of our mammalian species. Just like ketone bodies, small changes are completely normal. So reductions in total calcium are normal as well in transition dairy cows. So this is calcium levels, looking at days relative to calving, with the dotted line being the day that they calve. This is normal calcium levels. As we come towards the end of calving, we're going to see a dip in calcium and then an increase again. So completely normal. And as I mentioned, our body's really good at responding to it. Dairy cows are known to lose 9 to 13% of their skeletal calcium in the first 30 days to compensate for the calcium needs in milk. And it can take about 4 months for that to resolve, but it is completely normal. The problem is when something breaks down in the system, just like with our hyperkalemia. So when something breaks down in the system, we have another fun process known as hypocalcemia. So hypo meaning less, calcemia being the calcium. And when we think of hypocalcemia, we have two different groups, just like with hyperkalemia, of a clinical version and a subclinical version. Now, the clinical version is probably something that many of you are familiar with. That's when we have that down cow with milk fever. It's that cow that's down within 24 hours of calving. We often feel cold ears. Their heart rate will be low. You may notice that they're not burping. They may bloat because their ability for their rumen to move is being affected. Our subclinical cows are the ones walking around looking normal, but unfortunately, they're set up for negative health and production outcomes again. Just like hyperkalemia, the vast majority of our animals fall into this subclinical category. So clinical hypocalcemia is about 5% we see that about 5% of the time. We're also seeing it less and less, I think, as people are better at recognizing it and treating it. The subclinical form, we're going to talk a little bit more about, because it is kind of our challenging section, because it's hard to identify. It's linked to a lot of things and we don't fully understand it. Our cows that are more likely to have hypocalcemia are older cows. They're less efficient at mobilizing skeletal calcium, and so they're going to be more likely to have a problem during that transition period. Cows with increased milk production have a greater draw for calcium, so they're predisposed or at an increased risk. And Jersey and Guernsey breeds are at an increased risk as well, and that has a lot to do with the fact that they have fewer vitamin D receptors on their intestines. And so that's actually a genetic predisposition. Finding it's a little bit of an easy thing to do with our clinical cows. They're down within a day of calving. They usually have that stereotypical way they lay down. Some people talk about them having like the S-shaped neck, where they kind of, their back's curved and their neck's around. Our subclinical cows, not as easy to figure out. And so we're going to talk a little bit more about that in just a little bit. So right now we're going to focus a little bit on treating those clinical cows. So how do we treat them? This one's pretty common treatment. It's been around for a very long time. Giving them a bottle of IV calcium. Our mainstay of treatment is a 500 ml bottle of 23% calcium borogluconate or gluconate. We want to give that slowly while we monitor the heart rate, because if we give it really, really fast, we can stop the heart, and we don't want that to happen. And it's a really big recommendation from me as a veterinarian, but also in the literature, not to give more than one bottle. There's not been any benefit shown in the literature about giving 2 bottles. It also increases the risk of death as well as relapse for these animals. If you've given 1 bottle and there's no improvement, there's likely some other concurrent thing going on. And before you gave that bottle, did you check? What about her musculoskeletal system? Is she down because she hurt herself? Does she have mastitis? If she has massive sepsis? All those, we talk about the M's of the down cow. Make sure you've checked all of those if you don't see a response from a bottle of calcium. So if you've given a bottle and you don't see improvement, that's the time you want to call your veterinarian and have them come and evaluate this cow to see what other things might be going on that we may need to address. Another thing that's important to know when we give cows IV calcium, kind of how how the body reacts to it. So this is a graph of calcium in the body, so in the blood, and the hours after treatment when we give IV calcium to a cow. So this is a cow with clinical milk fever. She starts out with a calcium level that's really low. Normal here is that tan line. So it's really low. It spikes way up when we give a bottle of calcium, and then it starts to come back down. What's really interesting is even in our clinically hypocalcemic cows, so our milk fever cows, it starts to go down below normal again. So we do need to give them something to support them after that initial IV treatment to help sustain them longer. Our two options that we have are giving a calcium bolus. It's really important if we're giving them a bolus like a Bovacalc that the animal is alert and standing so that they're swallowing appropriately, because we don't want that cow to choke, and also following the directions, such as for Bovacalc that gets repeated in 12 hours. Or we can give that animal some sub-Q calcium about 2 to 4 hours later. I do want to make a point here that it's also really, really, really important that those cows have access to fresh feed at all times as well, because they need to start eating feed to help replace the calcium as well. So just think about that when your cow's in your sick pen. Make sure that they've got access to good feed. Sometimes that can be a challenge depending on where your sick cow pen is. But if you've treated a cow for milk fever, you want to make sure that's there so that they don't have this relapse and go down again. For our subclinical cows, again, we're going to hold off a little bit because we're still kind of trying to figure out how we treat this. It's a bit of a black box still in the world of research and kind of where we're at. Prevention sounds a lot like what we've talked about already. Optimal cow comfort, that's a huge one, especially when we're talking about things like stocking density, heat abatement, access to feed, all those kinds of things. We want to make sure that our dry cows and our fresh cows have that optimal cow comfort to the best of our management and our ability. We want to focus on nutrition. Again, it's really important, and we've got some nutritional strategies that we're going to talk about as well. We want to focus on appropriate nutrition for these animals. Calcium supplementation is an option, and we'll talk a little bit about that. And also monitoring the transition period is another thing we want to see. How are we doing with hypocalcemia? We want to monitor it and make changes when we can. So cow comfort, as we talked about, really important basic things. But appropriate nutrition, we have quite a few strategies. One of the first ones, always optimizing feed intake. Whenever we can get feed in our cow, appropriate balanced rations into our cows, it's really crucial. So that's like number one. Another thing we want to do is make sure that our diets are low in calcium and phosphorus. And one of the ways we can do this, if we have feedstuffs that we know are higher in those two elements, is we can use things such as binders, and we'll talk a little bit more about those. Another thing we can do is feed a negative dietary cation anion difference diet, so a DCAD diet, and we'll talk a little bit about what that means as well. So calcium binders are this really awesome kind of crazy looking thing, because it's like this kitty litter looking stuff that actually bind dietary phosphorus, calcium, and magnesium. And what they are able to do is they bind these to keep them from going into being absorbed by the cow, but they also seem to increase the active form of vitamin D. And have shown decreased prevalences of hypocalcemia when fed to animals during the close-up period. So it is a pretty cool product, and more nutritionists, I think, are starting to adopt it. We haven't seen any production outcomes, but we do see that prevalence decrease in hypocalcemia. More traditionally, and I think a lot of us have learned about DCAD diets, is altering, basically what you end up doing is altering the acid-base status of your cow. And you do this by feeding lower amounts of cations, which are the positively charged ions that are in the feed, and increase in the amount of anions, which are the negatively charged elements in our feed. And what that does is it causes the body to retain a lot of hydrogen ions in order to keep the balance, because we all we always want an electroneutrality. And by doing that, we actually improve the sensitivity of the receptors for the hormone that tells the body to retain calcium. So it's that parathyroid hormone receptor, which is on the kidneys and the bone. It improves the sensitivity when we have an acidic state. And so those receptors are more likely to bind the hormone and do their job. We see that we see that we're affecting the flux of calcium within the body, which means that the body's mobilizing calcium and doing its job better. And we also see that there's some bone resorption when these animals are fed DCAD diets, also showing us that the body's doing what it needs to do to flux calcium around. The big things is when we feed DCAD diets, when we look in the literature and do these things called meta-analyses, where we read a whole bunch of papers and find all the findings and kind of consolidate them, we see that by feeding DCAD, we can increase blood total calcium at calving, we can increase postpartum dry matter intake, we can increase milk production in older cows, we can decrease the risk of milk fever, and we can even decrease the risk of retained placenta and metritis just by feeding a DCAD diet to our animals and achieving an appropriate acidification. And so these diets are awesome. And I think they have a really great place on our production systems. Another thing that people have looked at is, hey, can we just feed some additional calcium to help them get over this dip? So like kind of keep it from getting as low as it could be. Of course, we have options for that. We have injectable calcium and we have oral calcium, but I want to talk to you a little bit about which ones are the ones we really should be using in this case. So injectable calcium, as you can imagine, can go IV or sub-Q. It's that calcium borogluconate. I really want you to listen to this one. IV calcium for prevention or treatment of subclinical hypocalcemia, so not the down cow, the one that just has low calcium, is not beneficial. It's not beneficial at all, and you shouldn't do it. It actually can be detrimental to our cow. And use of subcutaneous as a treatment option for cows that are not down may or may not be beneficial either. And so when we're talking about supplementation, what we see in IV calcium, as we saw in that first graph earlier, if we're looking at calcium and time, here we have black line here is our control cows. So these are cows that receive nothing. We have IV calcium, which are black dots, and the dotted line. You'll see IV calcium shoots right up and then it dips way down. So if we're talking about cows that maybe are just slightly low in calcium and not to the point where they're down, if we give IV calcium, we're increasing the risk of them ending up as a down cow because of this refractory period that we see after we give IV calcium. Sub-Q calcium also seems to have a similar effect. Now, remember, this is not talking about a clinical cow, okay? Because these do have benefits when it comes to our clinical cows, but our non-clinical cows, we have this rebound effect, which actually may be detrimental and put them into a clinical state. So in this graph, we have calcium here and time. The control cows are in black, and these are just regular cows that were receiving supplemental sub-Q calcium. In this case, it's the red line. You'll see it peaks up and then it dips down again. And so it's dipping way down where normal is up here, it's dipping down again. So we may unfortunately put our cows in a worse state. So does it cause a rebound hypocalcemia? We're looking at it even more. Again, sub-Q, this is another image with another study that looked at calcium time after calving. Again, it increases calcium, but dips it down again. So the take home here is if we're supplementing cows calcium, we do not want to give them IV or subcutaneous calcium. It's not helping them, and it may actually have this refractory effect, which results in them dipping lower in calcium than we intended. Oral calcium, however, may be an option, and we'll talk a little bit about who this may be beneficial for. There are drenches and boluses. I personally think boluses are a better option, but there is some difference between the bolus. I will say Bovacalc's lovely that it's got a fat coating. It makes it easier to administer. It's also not as disgusting on their mouth. If you've ever licked a calcium bolus, you'll know that they taste disgusting. I have licked quite a few of them and they are gross. And also we have to understand that there is some difference depending on the calcium source when it comes to the availability in the intestinal absorption. I am not an expert on those differences. I do have some data for it if someone really would like to look at it and has a question, but I will say that if you would like to talk to someone more about that, I can hook you up with someone. It's also important that we achieve enough calcium in the rumen for it to be absorbed. So those boluses need to have enough calcium as well. So the big takeaway here is that not all calcium boluses are created equal. These boluses are great because they can be easy to administer. Like I said, not all calcium boluses are created equally. It's also really important that if these are severely hypocalcemic cows that are clinical, we shouldn't be giving boluses until they're up and ready to swallow again because we don't want them to choke. We also want to make sure that we train everyone and learn how to do this the right way, because as I mentioned, not only do they taste gross, some of these calcium salts are very irritating to the mucosa. And if we don't administer them swiftly and correctly, they can actually get lodged in the esophagus and become potentially a lethal thing. They can also be lethal if you're administering it incorrectly and it goes down the wrong way. So there are some great videos online nowadays to talk about how to administer them appropriately. Your veterinarian may be able to help you with this. So just keep in mind that there is a little bit of a learning curve when it comes to administering these, especially in Jersey cows. They are the worst. Oral calcium supplementation, again, there's a little bit of differences between the boluses. Some require that you administer them twice within certain distances and time. So just keep that in mind when you're looking at your boluses. And the real question is, do they actually affect cow health and production? And this is my other moment where I said, they may be effective for some cows. It kind of depends. So what we've realized when we've looked at analyses of all the data that's looked at these oral boluses is that we haven't actually seen a blanket improvement from giving supplemental boluses to prevent hypocalcemia. There are definitely positive subgroups. These are things like third lactation cows, so much older cows, lame cows, cows with high body condition score. But not all of our cows are seeing benefit. And that's when we look at things like milk yield, pregnancy to first service. So we've looked at a lot of different things. So we've really got to start working, and this is where research is really focusing now. What subgroups do we need to look at? Which are those cows? We have some ideas, but we don't really know fully. We know that short-term calcium increases have been beneficial for subgroups of cows. We know that some groups really not good. And actually our first lactation cows, oral calcium boluses are actually detrimental to them. They make them do worse. So we need to think about different like which groups do we really want to look at? And if we do have to do that, especially for subclinical animals, we need to figure out how to test for that. When we test for calcium, one of the things we need to think about is how to test for calcium. So calcium lives in the body in 3 different groups. We have calcium bound to proteins, we have free or ionized calcium, and then we have complexed calcium. So we can measure ionized calcium. It's really great because it's very biologically relevant. It's the calcium that kind of gets used and moves. But we really have no way of doing that cow side or doing that in an inexpensive way. If we tried to take samples for that, it's annoying. You have to store them in certain ways. You could only have them run in a lab. It's all sorts of a challenge. We can measure total calcium, however, and it is fairly easy to do. You can draw a red or green top tube, which you can get those from your veterinarian. They're very stable if put in a regular refrigerator. So 20 degrees C is your standard, about 40 degrees Fahrenheit refrigerator temperature. Sorry. Yeah, and they're very stable. They do really well, and they can be sent to a diagnostic lab, even just sitting for 14 days, which is fantastic. As I mentioned, there is no practical on-farm testing that we can do for testing calcium. All of the things available cost thousands of dollars, like this lovely iStat unit. Your veterinarian may have them, but purchasing it for your farm, definitely a cost limitation. We can collect these samples and learn information though. So for our clinical cows, if we get one of those samples before they get treated with calcium, you can put that in your refrigerator so that if they don't improve, you can hand that to your veterinarian and say, I got this blood sample if we want to test it further. And if we're wanting to monitor our cows to see how our transition period is going, we can take blood from cows at 4 days in milk and store that in our fridge and submit that to the lab later. And your vet can collect them every couple weeks and submit them. And that's a wonderful way to kind of see how the transition is going when it comes to our cows. And so you'll notice I chose this time of 4 days in milk, which is not some time that you probably think of when you're thinking of hypocalcemia. But what we've learned is when we're looking at hypocalcemia, yet again, is all drops in calcium bad? What happens if it drops at calving or 24 hours or 48 hours later? What is normal? We're still learning that. And so we're learning right now, and this is all very new stuff, that there are dynamics when it comes to calcium. And so can we look at those and put them into cohorts and understand them better? And so I'm going to go over this, and I know I'm getting tight on time, so I did want to go over this because I think it's really fun and exciting, and it is the reason why I'm suggesting that you draw blood at 4 days in milk if you're just looking at your calcium status of your herd itself. And that's because we know cows fall into 4 different groups when it comes to calcium. We have cows that never drop in calcium. They always have normal calcium, whether it's right after calving or 4 days after calving. We have some cows that drop at 1 day in milk and then they're back up to normal at 4 days in milk. We know that there are cows that are low for the first day and the second and the 4th day. And we know that there are cows that did well and then for some reason they went low again. And this is all through going out to tons and tons of herds and drawing a lot of blood. And so what that looks like, the normal calcemic cows, we're going to pretend this is our calcium here and our days in milk here. If we draw blood on cows and we watch them kind of go through this period and they never drop low in calcium, they're normal calcemic cows. They don't become hypocalcemic. We do have some that are transient that happen to go low at their first day and they go rebound really nicely. We have some that go low and stay low. And then we have some that were doing okay and then something happened and they fell off again. And so what we learned from this is that there's a big difference in the dynamics from our cows. We know that some cows can do this really well, and we need to understand that maybe at day 1 in milk, they're actually not really in that bad of a state. But when the calcium continues to be a problem later on, it's when we really do start to see some problems. And what's going on? Are they not eating enough? Is our homeoretic mechanism not working correctly? Are there other diseases that are going on at the same time? And so what we see is those cows that stay normal the whole time or dip on day 1 and then come back up are more likely to have increased dry matter intake after calving. They're less likely to have diseases after calving. They have better reproduction, and some of these cows even have higher milk. And it's these cows that are low the whole time, or cows that started off okay and become low by 4 days in milk. These are the ones that really struggle. They have reduced intake, there's increases in disease, they have poorer reproduction and poorer milk yield. And so we're actually starting to look at cows in this way of knowing them as a classification of whether they're eukαλcemic, so their calcium's, instead of just saying hypocalcemia, that their calcium level is working appropriately, it's staying normal, or if they're dyscalcemic, so something's broken. And so a lot of the active research when it comes to calcium now is looking at, are these dyscalcemic cows, or the ones that are subclinical persistently, or they have a delayed subclinical condition? Is there some association with inflammation? And we have some good evidence to push us in that direction. And is there a relationship between dry matter intake and this? And so there's a lot of active, cool research happening on that. And I think in the next couple of years, we're probably going to start having a better idea of how we can look at these subclinical hypocalcemic cows and really focus on those dyscalcemic ladies and start figuring out, when should we be testing for them? What is the cut point that we really should be using? And what are some ways that we can address treatment for them? It may be something where we're giving anti-inflammatories. And so it's kind of exciting stuff that's in our future. So our main takeaways when it comes to minerals are going to be not to forget the importance of nutrition and cow comfort. And so these are things that you have so much ability to take effect on. You can think of, it's an area where changing some small things can have some big rewards, whether it's investing in some new fans, thinking about trying to separate our first lactation animals out so that there's less stress in the transition. It's really an area that we can focus, and it can have some big takeaways. The other thing that I just want to make sure you guys all take away from this is stop giving injectable calcium to non-clinical cows. And if you're giving IV calcium to non-clinical cows, definitely stop that as well. It actually may be doing them a detriment. And so let's focus on using oral calcium supplementation for those animals. And the other thing is, if you want to start monitoring how calcium is doing in your herd, the time to measure them is at 4 days in milk, and it is a stable, easy thing to collect. And it's something that your herd veterinarian can help you monitor and keep an eye on, especially because those can be stored in the refrigerator, which is really handy. The big takeaway here for all of these disease processes is an ounce of prevention is worth a pound of cure. And this is a fun, I asked ChatGPT, this is my AI for the day. I asked it to put Benjamin Franklin, who said this, in a picture with a cow. And so it made me this beautiful image. But really, these disease processes have so much to do with how we manage and feed our cows. And we can see such big differences in the incidence of them on our farm if we can make some small changes in those areas. So work with your veterinarian, work with your nutritionist, work with your extension team to help work on improving things like, crop quality, the management of your silages. All these different things can have such a huge impact, and then keep you from having to deal with all these prevention strategies. So with that, I'm really happy to take any questions that you might have. You're also welcome to Google me and email me at my email address, which is kdb23@Cornell, if you have follow-up questions as well. It's something I'm always happy to kind of answer what I can and talk about anything transition cow that you may have questions on.
Thank you so much. Does anybody have any questions before we kind of wrap up for today? All right, well, thank you so much. And for those of us that are looking to join next month, we will be talking about on-farm assessments. So on-farm audit programs can be used to help identify what's working well and where improvements can be made by gathering data, verifying compliance, and comparing results to common industry benchmarks. So you can join us with Dr. Clem Nash to explore the Novus Cows program, and Dr. Bill Stone to learn about the Diamond V TMR audit program next month, and discover how you can use those tools to support your farm's performance goals. And with that, thank you very much for joining us today.
Thank you for inviting me. It was really fun.
Yeah, thank you so much.